Med history.
Myocardial infarction, heart attack, is the development of necrosis of the heart muscle due to acute insufficiency of blood flow, in which oxygen delivery to the heart is disrupted. It can be accompanied by pain in different parts of the body, loss of consciousness, nausea, sweating, and other symptoms. Myocardial infarction is one of the most acute clinical forms of coronary heart disease, CHD. Etiological factors of myocardial infarction can be divided into two groups. 1. Atherosclerotic lesion of the heart arteries and the development of blood clots in them when an atherosclerotic plaque ruptures. 2. Non-atherosclerotic lesion of the coronary arteries, which arose due to an inflammatory process in the walls of arteries of various etiologies. What is the danger of atherosclerosis? In the future, as the ability of blood vessels affected by atherosclerosis decreases to deliver the amount of blood necessary for the operation of internal organs, these organs themselves are affected. This happens either slowly and gradually, due to the growth of atherosclerotic plaques, or acutely, with the development of vascular thrombosis. Vascular thrombosis can lead to myocardial infarction, stroke, gangrene of the lower limb. In medicine, there is a strange situation when there are names of corresponding diseases for atherosclerosis of a number of organs, although in fact the disease is the same, atherosclerosis, and only the predominant localization of the process may be different. In particular, in the presence of symptoms of damage to the arteries of the heart, coronary, they talk about coronary artery disease, CHD, with symptomatic damage to the arteries supplying the lower extremities, about atherosclerosis of the arteries of the lower extremities, intermittent claudication, and for example, with rupture of an atherosclerotic plaque and thrombosis of one of the vessels supplying the brain, about ischemic atherothrombotic stroke. Risk factors for atherosclerosis. The occurrence and development of atherosclerosis cannot be reduced to any one causal factor. Usually it is an interweaving of causes. However, among all the reasons, we can single out those that are related to the genetic characteristics of a person and those that are due to lifestyle. In cases associated with genetic breakdowns, no other reasons for the development of atherosclerosis may be required, and the disease may be very malignant when, for example, a myocardial infarction or stroke occurs in the third or fourth decade of life, and life itself is significantly shortened. Cholesterol and atherosclerosis. Genetic breakdowns are caused by the so-called familial hypercholesterolemia, in which lipid complexes containing cholesterol moving in the blood are poorly captured by tissues, primarily the liver. As a result, the concentration of these particles in the blood and accordingly cholesterol increases, and excess cholesterol, as well as its esters, end up in the artery wall. Of course, this process is much more complicated and in fact is multi-stage, but the end result is the formation of atherosclerotic plaques in the walls of blood vessels. An increase in the concentration of cholesterol-containing particles in the blood may occur much more often not due to genetic breakdowns, but due to an unhealthy lifestyle. The amount of cholesterol coming from food does not play any significant role for the development of atherosclerosis, contrary to the ideas that have existed for many decades. Therefore, there is no scientific justification for limiting cholesterol in food, and all the advertising hype around the fight against dietary cholesterol is meaningless. The fact is that almost all cholesterol is formed inside us, largely under the influence of what we eat, and certain types of food, fast food, many semi-finished products, fatty meat and fatty dairy products, margarine, palm oil products, etc., contribute to the accelerated synthesis of our own cholesterol. Cholesterol itself is a vital substance, and each of our cells is able to synthesize it as needed. But when the body's ability to use and dispose of its cholesterol decreases, that's when its concentration in the blood increases, with all the further consequences. Factors that change the chemical composition of lipid particles, which include cholesterol, reduce the ability to recycle their own cholesterol. These are, for example, smoking, diabetes mellitus, chronic inflammation. These same factors damage the walls of blood vessels, thereby facilitating the penetration of cholesterol-containing lipid particles of blood into them.